What's up, guys? My name is Alex, and I just wanted to make a video talking about how I've been prehabbing for my ACL surgery that's coming up in 4 days. So I just kind of wanted to talk about what I've been doing these past couple weeks. Just to give y'all some context, I tore my ACL about a month ago. I was at a soccer game, and I went in for the ball with my left leg, won it, and then my right knee caved in, and did the typical ACL motion that leads to the ACL tear. And basically, for the past two or 3 weeks, been going to physical therapy and just kind of working it, getting it to the point where it is now. Right now, I have almost full extension in my knee and almost full flexion in my knee, so I'm doing pretty good, feeling as good as someone with an ACL tear can feel. Right? It's been kind of hard, just kind of dealing with it, especially because, it's kind of taking like a big part away in my life, like soccer, right? It's everything I used to do, right? So yeah, let's just get into some of the exercises that I have been doing. So before we get into the exercises, I kind of just wanted to show y'all the clip of when I tore my ACL. So it was actually at a game, and I know the angle's pretty bad, but y'all will see. I'm marked in the circle, and you'll be able to see. This right here was moments before I tore my ACL. Yeah, so the first exercise that y'all are going to want to do, right, and that I've done probably the most of, is slides, knee slides. So basically, you're going to have your good foot in a comfortable position. I typically have it straight, just so I can compare. And you're going to need an extension band. And basically what you're going to do, right, is you're going to wrap that around the top of your foot, probably around the balls of your feet, and you're just going to slide, right? So let me move this out the way so y'all can see. You're just going to slide, right? And you're looking for full extension as much as you can, and I mean full flexion as much as you can and full extension as much as you can. And as you can see now, I've got pretty good range of motion. There's not much you can tell, right? But when you're first starting out, it's gonna take a while, right? A lot of people, they don't do prehab before going into ACL, and I kind of want to see the difference from when you do prehab to when you don't, right? Because obviously having these muscles back to kind of what they were before definitely helps, right? So the next exercise you're gonna want to do, you're gonna want to get a towel, and basically what you're gonna do is you're gonna wrap up this towel as much as you can, right? So you're gonna fold it up, kind of like that, right? And you're gonna get sort of a gap, right? All you're doing is gonna get a gap. You can get something else as well, but this is what I found to work the best, right? And when you're first starting out, what you're gonna want to do is place it right underneath your knee, and you're gonna just try to flex your quad, right? So the idea with this is just focus on quad activation, and you want to push down into the towel itself, right? So for me, it's pretty easy. I've been doing this for a while. I don't know if it's kind of hard to catch it on camera, but you can kind of see the quad flexing and unflexing. And as you get better off, as you practice this more, and as you're getting your strength back in your quad, you want to move this towel further down so that it is over your heel, like that. You want to push down as much as you can, flex your quad, right? So that's some of the stuff that I've been doing for getting my quad strength back. I also use E-stems at the physical therapist, and basically it's just, they put little pads on your leg, and it shocks it to stimulate the quad, and so I can get some strength back. So the next thing you're gonna want to do is actually straight leg raises, right? So it's pretty straightforward, right? You don't even need the band for this one, right? You're just gonna lay down flat and then raise. And you want to go not too high, probably about like where I am now is as high as I would normally go. And you really want to focus on reactivating your quad as you're going up, because again, you're trying to get that strength back in your quad. And you're probably going to want to do, 30 of these. Now, my physical therapist has said for me to do around 50 of them and do all the different variations of them, which would be like the sideways one, which would go like that, right? And the other side, which you would go something like this, right? Turn and then lift, And it's just kind of get to activate as much of the quad as you can. And then the backwards one I would also do, but I'm not going to show that one because I'm not on a surface where I can do that. So yeah, that's kind of when it comes to straight leg raises, what I've been doing. So the next thing I've been doing is actually doing some stretching of my calf and my hamstring, right? It's called calf and hamstring stretch, but I mean, it's pretty simple. If you're a soccer player or if you play almost any sport, you probably know about these stretches, right? Just gonna want to wrap the extension band around the balls of your feet or a little bit higher, and you just want to apply some resistance on it and just flex that calf. Make sure you're getting a good stretch. I feel it at the bottom part of my knee, just so you can see, bottom part of my knee right here. It feels like it's getting pulled on, and also my calf as well, because this is a calf stretch, right? And yeah, so the idea is just to pull on it and give some resistance so that it gets a good stretch. The next thing you're gonna want to do, you're gonna hold that for a minute, by the way. The next thing you're gonna want to do is the hamstring stretch, right? Same thing, you're gonna put the resistance band around the same part, right? Maybe a little bit lower. And you're just gonna wanna pull on, apply some resistance, and go up with it, right? Try to keep this leg as straight as possible. Helps with extension and also with getting your quad to flex. Good stuff. You should be feeling it around here, the back of the knee. The idea with this is just make sure you're getting your hamstring activated and you're getting a good flex of the knee, right? So you're extending it fully. So the last thing I do is I just get on a bike, stationary bike that is, and I'll just do 10 to 30 minutes on it, just as much as I can do, right? And I just go pretty easy. Get some resistance, so I get some quad activation, but for the most part, it's a pretty simple process, as you can see. Just keeping it simple and not crazy resistance. As you can see, I have one in my room, right? So it's pretty easy for me to get on it whenever I can. And yeah, so that's kind of the basics when it comes to what I've been doing. There's some more stuff that I do at physical therapy, but for the most part, that's kind of what's gotten me to the point that I am now, and it's kind of something that I recommend for y'all to do. So if y'all found this video helpful or interesting in any way, feel free to drop a sub or like the video. And yeah, thank y'all for watching. Hope y'all got something out of it.